Lately, we've been sharing lots of stories and lots of research about our healthcare. Today, I want to share with you a clip that is featuring Erin O'Toole, the new Conservative leader. In short, when Erin ran recently in the leadership, he was asked about private healthcare, and this is what he had to say about it.
Canada's healthcare spending is, as you know, among some of the highest in the world. Despite that, wait times have not been reduced, and in turn, more Canadians are venturing out of the country to access healthcare services. A 2017 study shows that Canadians made 217,000 trips outside of Canada to access healthcare. That's the equivalent of 600 treatments a day. Not even communist China prohibits citizens a choice when it comes to the provision of healthcare services for ourselves or our loved ones. Would you be prepared to allow provinces to experiment with real healthcare reform, including the provision of private, for-profit, and non-profit healthcare options inside of universal coverage?
Yes. Now I'll elaborate a little bit more. I refer to my previous leadership quite regularly. Our team now calls that the warm-up because we're going to win this one. But I also ran on this principle, Kate, because if we're expecting innovation and more choice and better performance, we can't have just one old model that is increasingly becoming inefficient because of the amazing new drugs that are dragging some of the funds into other areas in our healthcare system, especially biologics, which the Trudeau government also messed up in terms of the NAFTA negotiations. If we want to see that innovation, we have to find public-private synergies and make sure that universal access remains paramount. And I actually praised what Brad Wall did with respect to diagnostic imaging, because he's actually making sure that wait times for everyone go down as a result of the investment by the private sector to make sure there are more diagnostic imaging machines. I thought that was a brilliant move to show the public at large. There's going to be an overall benefit because everyone's wait times will go down, but people will be able to access services, and that capital will come in to drive efficiencies, drive innovation. In fact, there was a decision in Quebec, the Charuli decision, that says it's a right for Canadians. Now, because it was a civil code, not everyone applies it across the country. It is certainly, if the same issue came to the Supreme Court, there's no way they could say the state can prevent people, as you said, the communist China example. So let's try and do it in a way that's fair, measured, and keep the public with us. I've run on this for several years now. And I do think in the 905 my region, people are open to it, provided we don't let the Liberals define us. We have to have someone that can defend these principles and these ideas.
Interesting comments from Erin O'Toole. Hopefully, healthcare reform will become a priority in the days ahead, as changing the model may help patients while also keeping the universal aspect that Canadians love. You can learn more about healthcare reform and different models by visiting our website at secondstreet.org.